Hello, you're watching HD Live. Thanks for joining us. I'm Mabel Jung. The pandemic is affecting every community, but there's growing evidence that it's not affecting every community in the same way. According to data from the Kaiser Family Foundation, Black and Latino Americans, many of who are frontline essential workers, are about 3 times more likely to endure COVID-19 related hospitalizations and about twice as likely to die from the virus compared to white people. Now, concerns about equity have come up at many steps along the vaccine rollout. Why are they leaving behind many people of color? Here to share their experiences in their communities and what's needed to accelerate vaccine distribution, I'm so pleased to welcome 3 guests. Tasha Clark-Amar, CEO of the Council on Aging in East Baton Rouge, Louisiana. Jill Ramirez, Executive Director of the Latino HealthCare Forum based in Austin, Texas. And Professor Vickie Mays from the UCLA Fielding School of Public Health. Thank you to you all. It's so great to see you.
Thank you for having us.
Thank you for having me.
Thank you for the invitation.
So great to see you. Now, Tasha Clark-Amar, let's start with you. You oversee about 24 senior centers around East Baton Rouge. Now, if you check the official government website and look at the vaccination sites list, the vast majority of them are located not where you are, but in another part of town, a more affluent part of town. That's also where the hospitals are. Now, how does that impact your members' abilities to get vaccinated?
Well, it impacts them because it's not close to where they are. But before we've had a COVID-19 issues, we've always had health disparity issues in our community. And all it has done is compile or compound that issue. So it's difficult for my members, particularly because they're 60 and over, to get access to the vaccine, to get to the location, and to get access to the technology of online appointments and those sort of things.
Okay, so say you have members that do want to get their shots. It's very difficult for them to get to where those sites are?
It is. And so what we did as an agency is decided to be proactive instead of reactive. We set up an internal call center where they can call us. We have care managers, social workers on the phones that are filling out the online process for them, scheduling it for them, printing all the pre-consent forms, pre-filling those. And so we go and either bring it to them or they come to us. We have buses, our own transportation. So we'll go and pick them up and make sure that they get vaccinated wherever it is. We've also been working with the Louisiana Department of Health to start setting up vaccination clinics in the areas that are disparate.
Okay, and what about education? Do you feel like people are getting enough education and information about what the vaccinations are about?
I feel like people are listening to the wrong education, misinformation, miseducation, and wrong information. And so it's incumbent upon us collectively to do something where we teach our folks, listen, you won't get an extra toe or extra fingers. This vaccine will help you, help your family, and help others. So there's some misinformation that needs to be counteracted with some better targeted education.
Okay. Jill Ramirez over in Austin with the Latino HealthCare Forum. Thank you to you, Tasha. And Jill, over to you. What Tasha said just now was that a lot of these sites are not convenient. And also the signing up for the vaccines is difficult. Is that what you're experiencing also where you are?
Absolutely. We have the same setup that Tasha spoke about. The lack of historical investment into our community. We don't really have any of the healthcare infrastructure such as hospital, clinics, pharmacies, even stores. And so our community has to go out of our community into another community to try to access the vaccine. Okay, so however, we do have a couple of places where the city set up hubs But because the portal where people access is for everyone, we see that a lot of people from other areas of town, more affluent, are coming into our community and using the majority of the vaccine. So when you look at the statistics, only about 9% of Latinos are getting the vaccine, 2.2% of African Americans, and the rest are white. And so because of the portal, the technology component that a lot of our older adults in our population may not know how to use, they don't have the skills, they may not even have a computer, they may not even have access to having technology. And so when just the insistence that our elected officials and the people that set up the vaccine distribution, for them to use technology as the first way to access vaccine, that in itself is a huge barrier.
Right. And also add to that, the campaigns aren't necessarily multilingual. You're dealing with a lot of folks where English is not their first language.
Yes. Also, there has not been a campaign. There's been a lot of lack of information regarding vaccines and the safety and why should people use it. And so in the absence of good information, then we have a lot of misinformation taking root. A lot of the information that our people that they use in social media, such as Facebook, they pay attention to that in their language. And so there's not any public information coming out of public officials that is, multilingual, comprehensive information for people to feel good about taking the vaccine.
Mm-hmm. Okay. What about mistrust of, or maybe fear that people don't want to come forward to get their vaccines because perhaps they are undocumented workers? Is there some of that going around as well?
Well, for the last 4 years, a lot of immigrants had a target in their back. When you look at public charge, if you obtain services, it counted against you. When you have people, children in cages, where you had work rates. And so that did not create a good environment for our people to trust the government. And so now we are seeing, a lot of things happen, a lot of results of a bad policies, historical policies. I call it coming home. The chickens are coming home to roost, whether it's with the healthcare system or whether it's with the immigration system.
Okay. Professor Mays, over to you. Can you address the historical nature of the hesitancy that still seems to exist both in the Black community and also in the Latino communities?
Sure, it'd be my pleasure. Let me just start though by saying it's the Tashas and the Jills of the world that are going to help us get through this because they're doing exactly what we need. Some of this historical mistrust comes from not anything that is so far in the past, but it's actually things that are the recent times. For example, Black Americans are 22% less likely to be given pain medication when they go into an emergency room or in a hospital. We just saw the case of Dr. Moore, a Black physician that was begging to be treated with equity. She knew what the treatment should be. Those images are pretty powerful when they're out there. So people can think of ways in which they have been mistreated in recent times. Mm-hmm. And then the historical part is the stories from their families, the people who have died, waiting hours for treatment. The right. People, I worked in Katrina and in New Orleans, the ways in which people were whisked away and not even told where they were going. Same thing happened, in terms of being deposited in Texas and you'd never been there. So we have many governmental actions mm-hmm. that have been in a recent memory that people do not want to put themselves and their children. Remember, when people are the sole source of nurturance for their children, the risk that they take to do something to themselves, they worry about it in terms of their children and families.
Okay. Now, you have studied a lot about this virus and how it affects communities. Initially, when the virus broke out a year ago, the focus was the elderly and people in nursing homes. that they were the most vulnerable, but you found that the lacking of social resources is actually a big contributor to one's vulnerability.
Yeah, when it first broke out, one of the things that we all were listening to is if you had a pre-existing condition.
Right.
So that for some racial and ethnic minority kind of put a target on their back of feeling like they were somewhat doomed to have conditions. Well, actually, it turns out that one can have a pre-existing condition, live in all the right neighborhoods and right places, and not necessarily be the one at risk. So what we started thinking about, what makes you vulnerable to getting infected? What makes you vulnerable to getting infected is really the structural racism issues. So what we found is, for example, barriers to accessing services, the very things that Tasha and Jill are talking about, not having broadband. Our public health advice, for example, was to wash your hands. We did not even take into account for Native Americans in tribal areas. Water is a very precious resource. A significant number of people do not have access to running water. And we forget, agricultural workers. So just simple public health advice is steeped in class kinds of issues. Mm-hmm. We also had, where you live, the built environment. Many of us, when we live in neighborhoods and we're told, well, make sure you still get some exercise. Well, there are neighborhoods in which the sidewalks are so small that you can't really pass at 6 feet distance. Mm-hmm. We know that communities have dense housing. And the worst of this is when people go and do testing. They go in a neighborhood, they know what the housing is like, but they don't come with quarantine resources. They don't come with a hotel keys. They don't come with trailers. So that when you discover this problem, you don't send a person back into the same environment, but instead you mitigate it. So there's a lot of these social factors and social vulnerability also, and very things like, how do people get their information? I mean, it's like, Jill and Tasha nailed it when they talk about misinformation and the network in which we get information. And if you don't put it on Telemundo, if you don't put it on the news channel where they're really trusted sources for that news, mm-hmm. Well, you're going, here's another thing. The government sets up scams sometimes to get you to show up. Here's a prize, here's something, and people show up and ICE bust them, or, right. They have warrants. So there's lots of reasons to understand that it's not just having a pre-existing condition that's making this so worse in our communities. It is all of these kind of historical, structural discriminations that now, as Jill says, chickens are coming home to roost in the worst of way. Because in America, we're close to losing 500,000 people.
Right. And it sounds like from your work, Professor Mays, that you created a predictive model identifying populations most at risk. You've already talked a little bit about that, but these are people most at risk at becoming infected with the coronavirus. Now, how does that work inform the work that needs to be done to get more people in the Black and Latino communities vaccinated?
Well, what it is it's a model to roll out either testing or in the vaccine. And we're not talking about testing. We need to remember we need both things. We don't want just one, we need both. And what this model says is that communities can look at the maps. They can see, by the differences in colors where hotspots. They can be advocates with, whoever their legislators are. But what it says is where we need to be. And if you're going to set up mobile units, if you're going to do the kinds of things that Tasha's talking about, you fund their organizations to go and actually do this. And you go there. And if you're not going there, then what you need to do is figure a way out to get them to your place. See, one of the things about the first creation of the vaccine is how it's created presents an inequity, because one of the reasons that it's not in some of the communities is because the stability requires a major cold storage. So we had community clinics that were needing to buy these, ultra cold freezers. Right now, it's weeks to get them. So until you can meet the requirements, you can't have it. So who had it first? Major academic medical centers and hospitals, because they had an infrastructure. See, this begins to tell you, like, people in Africa are going to be behind the 8 ball until they get a vaccine that is, a stable storage that doesn't need a cold storage process. So what you're seeing is that it's not as easy as somebody's just discriminating right now, but it's the infrastructure. I think Jill mentioned this. It's the infrastructure that has been lacking that all of a sudden we need to build up. You can't get a cold storage freezer fast enough right now. So a community group that wants to come online, it probably needs to go get a freezer truck or something, because it's so difficult right now to get everything set up so quickly.
Now, back to you. Thank you for that, Professor Mays. Now, Tasha, back to you. What sort of efforts, you'd mentioned already about the transportation and really trying to help members get organized online to get their appointments. What else have you had to do at a grassroots level to really address the needs of your community?
Well, what we did is, because we are not clinicians, we got with the pharmacies and asked them, listen, we'll offer you a space at our facility. We'll offer you the people, and you can come into our facility, like Albertson's Pharmacy. Come to us. We'll have the people. We'll do all the legwork. We'll do all the paperwork. All you have to do is put needles in arms. And so partnerships like that have worked. We've vaccinated over 2,000 folks thus far that were not on the radar to be vaccinated, because they weren't in those areas. And so we also offered our transportation. If you have it at the store, you have 50, we'll bring 50 people. Social distance, of course. And so we made sure we did grassroots efforts. And in the meantime, while our seniors were waiting, we do phone calls, text messages, and videos every day, just explaining to them, and on our radio program, here's why you should be vaccinated. Here's why it's important to you. Here's why you shouldn't listen to, the teenagers. And here's why at your age, it's critically important that you get vaccinated, because you want to see these teenagers grow into adults. And so we focused on educating our seniors and beating back every myth and every misinformation that they brought to us. We said, tell it to us, and we'll tell you the reason why that's incorrect. And so we spent a lot of time doing that as our folks wait to get access to the vaccine. Matter of fact, we're setting up a 2,000 clinic next weekend with our state legislators, our Louisiana Department of Health, and we just put in NGOs and churches. The churches are the pillar of our community. And so we should take the vaccine to the church. Let the clinicians come to the church, and you'll be surprised how many people you can get in one day at a multiplicity of churches. There's churches on every other corner, and we got to use them for Jesus and for vaccination.
Okay. Thank you for sharing that, Tasha. And Jill, it sounds like you have also had to roll up your sleeves and get down and speaking with people in different languages. You set up those phone banks. What else are you planning, and what else do you need?
Well, we believe that there are organizations already going into people's homes, and we are advocating for some of those organizations to work closely with the public health authorities so that people don't have to leave their homes if they can't. So people's organizations such as Meal on Wheels, there are some organizations already doing a lot of work and taking the vaccine to where people naturally meet, just like Tasha just mentioned, churches, schools. In our community, we have what we call ice cream trucks. So I thought, why don't we use an ice cream truck as a mobile place to keep the vaccine, and the kids get ice cream and the adults get their shots. We just thinking outside the box. Our community healthcare workers are working closely to try to navigate the phone system. Luckily, we hear that at the end of February, our health authority is going to open a call center that will be multilingual, and they'll have a lot of people answering the phones, because right now they only have like one phone number with very few staff. And so it just becomes overwhelming. I think, you know, you have to take it to the community. Our community really is not, you know, otherwise, you know, you have to set up for transportation, and that in itself is difficult. And so we are advocating for the same thing Dr. Mays mentioned, looking at what, you know, post-COVID, what are we going to do away with those structural racist infrastructure that we had, because right now we're trying to use that infrastructure that has not worked for us for a long time.
Right. Okay. And Professor Mays, it sounds like, as you said, people have to be innovative. They're thinking outside of the box and they're trying to get these vaccinations done. Is it enough, or are we going to need more federal and local aid in this effort?
Oh, beyond belief, we need more resources because we need their agencies to actually be funded to do this work. And particularly if the departments of public health or whatever the infrastructure is can't do it, they need to empower. They're already empowered by the community, but they need to be given the resources. As you can see, it's like they're talking about things that will work because they've been in that community. But I want to add something, and I'm going to add this both to Jill and Tasha's agenda, which is one of the things that we know is happening is that we're about to have a mental health epidemic because, I mean, we talked about the pandemic, but we're about to have a mental health epidemic because of COVID. So part of what we're worried about, and this is work that I also do, is we're starting to see an increase in mental health problems, in suicides, and in substance abuse. And as people that work in the community, they're well aware we don't have enough resources to treat people's substance abuse. We don't have enough resources, for example, to treat, you know, providers to treat mental health problems. What's going to happen? And this kind of reminds me of, you know, when I worked in New Orleans for Katrina, it is going to be the community agencies that are going to have to engage in community rituals and processes where they put up support mechanisms for people to check in. But it's the next big thing while we're worried about COVID. I mean, think about what it's like to be Black or Latinx, lose somebody in your family, and you can't provide the going home, you know, celebration for them. That's a hurt and a grief that people don't get over. I mean, to know that your mom did all that she could, and here you have to do this online stuff where her friends can't be there with her and comfort her children. This is leaving some very deep grief and wounds in people that we need to address soon. So I don't want to put more on your agenda, but it's like we're starting to see suicides in our community in ways we haven't in the past. So our children and the social isolation and then grief that we're experiencing. So it is the next aspect of COVID that is going to turn also into an epidemic. And I'm hoping that we can stop that epidemic kind of early.
Totally, I totally agree with you. And not only that, in Louisiana, the communal, you know, at the end of the funeral, that you commune together in a repast or a dinner where you get together and you say your goodbyes, and those have been cut out, and it's been detrimental to the community for sure.
Right.
To add that we started looking at grieving a while back when we saw so many people passing. And I'm part of a collective called Austin Latino Coalition. We actually got an artist to do a mural in one of the areas of where a lot of other artists practice. And so at that time, we had close to 300 people had passed. And so we put the number on the mural, how many people have died. And we invited community to come in and do a vigil. So, you know, I think we need to do more of those kind of things so that we can really have people grieve or talk about it. Because right now, I think people are just trying to take care of themselves the best they can, but not necessarily able to. And, you know, sometimes in my community, and I assume it's the African-American community, we are not taught to talk a lot about talk therapy. Everything we keep ourselves, and we don't disclose, and so all of those factors are involved, have negatively impacted us with COVID.
Okay. Well, it sounds like we need to check in with you ladies again on this developing story, but thank you so much for your time today. We've been speaking with Jill Ramirez, Executive Director of the Latino HealthCare Forum based in Austin, Tasha Clark-Amar, CEO of the East Baton Rouge Council on Aging, and of course, Professor Vickie Mays from the UCLA Fielding School of Public Health. Thank you. Thank you to you all.
Thank you for having us.
Thank you for the opportunity to share our information.
And thank you for joining us. You've been watching HD Live, brought to you by HealthDay. I'm Mabel Jung.